Hello, my name is David Villarreal. This presentation is going to be on the GAD-7, which is a screening tool for generalized anxiety disorder. This is for appraisals, and it's with Hillary Gifford. So let's go ahead and get started. I am going to make this a little bit bigger so we can see it easier. Slideshow. There we are. Okay. So, what is the GAD-7? So here on our screen, we have a quick sample of what this screening tool looks like. It's fairly straightforward. It's on a Likert scale from not at all to nearly every day, 0, 1, 2, and 3. It's a 7-item instrument. It's used to measure or assess the severity of generalized anxiety disorder. Each item asks the individual to rate the severity of his or her symptoms over the past 2 weeks. Responses options include not at all, several days, more than half the days, nearly every day. That's coming from the Child Outcomes Research Consortium. Pretty useful source just in terms of the information that they've collected on the GAD-7. And so you can see here the assessment itself is pretty quick. Typically, individuals are going to take between 1 and maybe 3 minutes at the most to engage with this. And this assessment tool has been through research, proven reliable for use with children and adolescents. And in part is because of the simplicity of this screening tool. So, feeling nervous, anxious, or on edge, not being able to stop or control worrying too much about different things, trouble relaxing, being so restless that it's hard to sit still, becoming easily annoyed or irritable, feeling afraid as if something awful might happen. So just thinking about that as currently working as an elementary school counselor, most of these feelings and words are pretty easily understandable by young ones. I would say probably as young as 3rd grade, maybe 2nd, depending on their reading comprehension. But I would say definitely at 3rd grade, the content of this assessment, like the words of the wordage, is accessible to children of that age range. So some things possibly would need some explanation, just depending. Things like maybe restless, that might need some explanation, or irritable, that might need some explanation. Like differentiation, like differentiating this for different populations, is persons or individuals that are suffering from severe mental illnesses. So in some cases, it could be beneficial, like to sit with an individual who, say, is schizophrenic, and just kind of like maybe further explain what some of these things mean. It is a self-assessment tool, so these are questions that they should be reading and answering by themselves. But I think in certain situations it could be helpful, if you're like a case manager or something like that, to just sort of assist. I've done that in the past. Anywho, moving forward. So what is generalized anxiety disorder? So I think I've got a short video here that I think could be helpful, just in terms of like talking about what this disorder is. I think would be beneficial in understanding why the screening tool uses the language that it uses, and is even as short as it is. I think honestly the length of the screening tool coincides with this disorder. So it is a mental health disorder that produces fear, worry, constant feeling of being overwhelmed, characterized by excessive, persistent, and unrealistic worry about everyday things. So let's go ahead and watch that video right quick. Okay, that was that pretty good summary of generalized anxiety disorder. So, I think this particular disorder, I gravitated towards this screening tool because of this disorder. My mother suffered from this, still suffers from generalized anxiety disorder. And so, having just grown up around someone who's got it, I feel like, this is an opportunity for me to understand it a little bit better. And, and so, I just remember medication management was a part of how this was helped, and how my mother took care of her disorder. But, you know, that wasn't quite enough. I think had she taken this screening tool, on a fairly regular basis, like maybe once every few weeks, just being able to track where she was falling on that scale might have been helpful. I think that honestly, this is something I could share with her, is the GAD-7. Just say, hey, just check this out. Could shed a little bit of light on how you're feeling. Sometimes we're too, it's hard for us to see outside of ourselves. And so sometimes these screening tools act as a means for us to take sort of a backseat, like look through a different lens. So what is the GAD-7? This is just a little bit more about it. So the GAD-7 again, it's a measure used for screening, diagnosing, and monitoring the symptoms, severity of anxiety, and it's specific to generalized anxiety disorder. And so that I think I get into a little bit later, but it's important to note that this is for generalized anxiety disorder. When you look at the DSM and you look through anxiety disorders, there's a lot of different ones. Like there's different phobias, post-traumatic stress disorders. There's not, like this is specific to the GAD. And so, that is something of a limitation, and we'll talk a little bit more about that in a second. So just some quick breakdowns of the scoring. So 1 to 4 points is minimal anxiety. Treatment may not be necessary at that point. 5 to 9 points, mild anxiety. Through a further evaluation could determine whether the patient needs to have their symptoms addressed. 10 to 14 points is moderate anxiety. This is where interventions become more targeted. That could include medication, psychotherapy, other interventions. And then 15 to 21, moderate to severe, interventions would most definitely be needed at this point. This is where medication and therapy are probably going to be both needed to try to maintain. So the GAD-7 has been validated for primary care patients, the general population, and adolescents. So it's been found to be useful for children and youngsters. So it's self-administered. It means the patient takes it on their own. It is quick, 1 to 2 minutes to complete. And so this is something that, if you were to go to a primary care provider, very often it's the PHQ-9, but just depending, sometimes this could also be thrown in to like an intake packet, or just, a returning patient, like here's a few items that we are trying to, just some information we're trying to collect from you. And because of the quickness, it is very appropriate for a primary care setting, where the patient comes in, they're given some paperwork to fill out. Here's the GAD-7, it's 7 items, doesn't take long, but provides a lot of information. So some symptoms, we kind of talked about that: restlessness, fatigue, excessive anxiety and worry, increased muscle aches and soreness, impaired concentration, irritability, difficulty sleeping. So all difficult things to deal with. Okay. All right, so next is a quick self-administration example. This is the MD Calc website. I'm a pretty big fan of this. I discovered this website this semester. And it looks like you can actually get, if you're working for a primary care provider or, a behavioral health clinic, something like that, you may get access to something like this, like further access, where you're able to keep your data, hold on to your data. So, anywho, thought we could just kind of take this together. And again, really just great website. It answers a lot of the questions that are needed for this presentation, specifically when to use this, rapid screening for the presence of a clinically significant anxiety disorder, especially in outpatient settings, pearls and pitfalls, the use in primary care, most commonly generalized anxiety, panic disorder, social phobia, PTSD, 70 to 90% sensitive, higher GAD-7 scores correlate with disability and functional impairment. Last time, how difficult these problems for you, take care of things at home or get along with other people, using this calculation to get an indicator. So just, pretty good information. And again, the website itself, it provides things like this, very specific ways to use this assessment. So it's ask the patient, how often have you been bothered by the following over the past 2 weeks? So very user-friendly website. I highly recommend this. Okay. So let's say right now, take this for myself. So I'm feeling nervous, anxious, or on edge. Got a couple of papers due. So I would say several days, not being able to stop or control worrying, not at all. Worrying too much about different things, not at all. Let's say, I guess different things, right? School, work, family. Those are 3 different things that I worry about. But there it is, too much. Am I worrying too much about them? Okay. And so that right there, I think, is something to consider. Because that can be, when we think about cultural implications, what is worrying too much to one culture versus another? So some cultures place a lot of importance on work, others not as much. Some cultures are very, family focused. And so we may need to think about, what is too much, and how that might have some cultural significance. So for me, that would be not at all. I do have worries about different things, but I would not say that it's too much. Trouble relaxing, not at all. Being so restless it's hard to sit still, not at all. Easily annoyed or irritable. When you're an elementary school counselor, that's just not possible. You can't be easily annoyed or irritable and be successful in this occupation. Feeling afraid as if something awful might happen, nope. And then, very important question, I think this is also very similar to the PHQ-9. How difficult have these problems made it to do work, take care of things at home, or get along with other people? So that'd be not at all. So 1 point, no anxiety. And look at that, it actually gives you the results right here. All right, so let's say I had said nearly every day on every single one of these things. Let's see how I would score then. What would it tell me? 21 points. Functionally, the patient finds it extremely difficult to perform life tasks due to their symptoms. All right, so what's the evidence here? So here is some information. So that's, I think, the creator of the GAD-7, Spitzer. So that, this will take you to that brief measure for assessing generalized anxiety disorder. There it is, Robert L. Spitzer. Yep. And just another one. Okay. And so it is a valid test, some creator insights. We can learn a little bit about this person's professor of psychiatry at Columbia for the last 49 years, or was, until he retired in 2010. Influentially, advancement of the DSM, recognized in many fields of psychiatry, severe mental illness to comparative diagnostics, such as the US-UK Diagnostic Project. Okay. So again, love this website. Would not be surprised if this person also Created the PHQ-9. Nope. Oh, but another guy that's familiar because it does ask that same, some of the same similar questions. Anywho, we are in GAD 7. So, self-administration example, pretty easy. I do, again, recommend MD Calc for that kind of thing. So, scoring, so 0 to 4 interventions aren't necessary. Once you get to 5 to 9, journal feedback, repeat GAD 7 to follow-up, consider adjusting treatment plan if not improving in the last 4 weeks. 10 to 14, further evaluation recommended. Active treatment plans consider adjustment, text therapy clients, monitor for sickness therapy. And then 15 plus severe, that's 15 to 21. Adjust treatment plan, focused assessment of safety plan, and pharmacotherapy evaluation and reevaluation. If emergent need, they consider referral to a higher level of care. That could look like having to potentially send somebody to like the mental health unit or to the ED in that kind of a situation. So, who is the GAD 7 best suited for? So adults in primary care settings, originally developed use in primary care, and to meet the demands of busy doctors where there is time constraint. General adult population, widely used in the community, clinical research to assess anxiety levels in adults. This is a great assessment if you are doing a research project on anxiety and need to quickly collect data because of how fast this assessment is performed. You could just, if you're doing randomized samples, here's this assessment, can you please take it quickly? You could probably print some out on a small note card and then just, quickly score it, and then you've got some data. Individuals who are showing persistent worry, restlessness, or physical symptoms, and cultural diverse adults, invalidated across languages and cultures, so Spanish, Chinese, Arabic, assuming translation is reliable. And just real quick, we can go back here. I want to say this MD Calc, I think, has some translations on here. Oh, maybe not. I'm sorry, I thought it did. But I'm fairly certain it would not be difficult to find translations for this assessment. Okay, potential cross-cultural issues. So I had mentioned one, just the idea of like anxiety for some cultures is normal, for others, some conceptualization of anxiety in some cultures, for example, East Asian anxiety is manifested in emotional distress. It might be expressed in somatic ways, feeling sick, stomach hurting, restless, which can lead to underreporting. There is some stigma around mental health. In parts of South Asia, Africa, and the Middle East, symptoms may be downplayed to avoid shame and judgment. And then gender norms, cultural representations among gender can provide a mix in reporting. For example, men might underreport anxiety while a woman might overreport or be more likely to report and express emotion, or vice versa. So scores of 5, 10, and 15 represent cut points for mild, moderate, and severe anxiety, respectively, when used as a screening tool. Further evaluation is recommended with a score of 10 or greater. Normative data for the GAD 7 were generated for boys and girls and different age levels. So that further evaluation part is a limitation because the GAD 7 is not a diagnostic tool. You can't have no diagnoses and then just take this and say, oh, I've got generalized anxiety disorder. Not that simple. If you do score 10 or more on the GAD 7, it is highly recommended to seek out further evaluation from a psychiatrist. I can actually diagnose. So, some psychometric properties. I'm just going to read through this. It's pretty, I guess, how would I say? It's pretty cut and dry in terms of just the language use here. So, internal consistency for this assessment. Internal consistency is whether several items that propose to measure the same general construct produce similar score. Research indicates the GAD 7 shows excellent internal consistency. Retest reliability. That is the degree to which the same respondents have the same score.